Well, hello. Thanks for taking the time to view this video. If you don't mind, let's talk for just a few minutes. Preserving our existing healthcare system while still providing healthcare for all Americans does not have to be a big gamble or a 1,000-page healthcare bill. Don't get me wrong, it also can't be done with just simple insurance reform like the Republicans have suggested. And the extreme on either side of this issue may not be what would be best for this country. Fortunately, there's an answer to this problem. Few people realize that there already is a viable single-payer system operating in the United States. The Veterans Hospital Administration, the VHA, which was founded at a time when health insurance was pretty much unthought of, provided a way for the government as a single payer to provide care for deserving veterans. Over recent years, with the decline in the number of veterans and due to underutilization, VA hospitals have been closing down. It seems ironic that at a time when we are concerned about providing care for the uninsured of our land, we would close down these facilities. Let's consider for a moment that if the present proposed healthcare plan were to be enacted and the entire private healthcare system were converted into a single-payer system, then the VA would really become redundant. All the current VA patients would have identical coverage under each of these two systems. So why would the government keep funding the VHA? That then raises an essential issue and suggests an alternative plan. Instead of doing away with the VHA, why not consider expanding this existing single-payer system to provide for the needs of all the uninsured in our country? This would be an ideal testing ground to see if the government can actually run a cost-effective single-payer system. Since the House version of the healthcare bill creates 53 new federal bureaucracies, they must be putting this bill together for more than just a national insurance plan to merely compete with private insurance companies. There is everything in this proposed healthcare bill, from a health choices administration to a health insurance exchange trust fund to a health benefits advisory committee. And there are 33 entitlement programs that are created or expanded in this proposed bill. Now please understand that I am a former Navy lieutenant, and it's my fervent desire to see continued health care for all of our veterans. But by converting the VHA to Public Health Administration, the new PHA, this would actually preserve priority care for our combat disabled veterans. In fact, there are presently 181,000 uninsured veterans waiting to get into the current VHA system. So we would take them out of the ranks of the uninsured and get them immediate coverage. Just as the VA presently maintains an evaluation system, new enrollees would be assigned priority status according to financial need, health concerns, citizenship status, and other key issues that would be defined by an appointed panel of experts. Financially able enrollees could purchase insurance from the National Health Insurance Exchange. This would be in lieu of more expensive private health insurance, provided, of course, that they are satisfied with the services delivered by the PHA. The entire system would be phased in over several years to minimize the impact on our struggling economy. Meanwhile, the existing private healthcare system would continue to function, but now it would have a compelling new competitor. This would drive healthcare costs down in the private sector. If the new PHA works well, then the entire system could be converted, as has been proposed by current legislators. If it does not work as anticipated, we still have an intact private healthcare system. At worst, we could attempt to return the VHA system back to its former state. Though that task might be daunting, it would not be the impossible task of trying to revert the entire private healthcare system once all of the new government bureaucracies had become entrenched. Perhaps it's time we stop fighting amongst ourselves. Instead of choosing between a complete makeover of the current private healthcare system as opposed to simply doing nothing at all, there is a way for us to reunite as a country. We can care for all of our people, from the poorest to the most prosperous, from the youngest to our most noble seniors, and from our healthiest to those most in need. Please pass this idea along to your friends, but mostly to your congressmen and senators. This must not be a contentious political issue. It's really far more important than that. Thank you.